Good morning, Leonard.
Morning, sir.
And then there's verbatim, so there's like 3 different times.
Statikai. Good morning, Leonard.
Good morning, sir.
Can you hear me, Leonard?
Yeah, I think there's another Leonard Mose online.
Yeah. Okay. I just want to say good morning. I'm
Good morning.
here.
Okay. Maybe for purposes of logistics, the commission might just do roll call just to get it out of the way. It looks like we have a quorum already. It's 10 o'clock. I don't know. It's up to you, Chair.
Well, Leonard, you're going to be in the office all day?
Yeah.
Okay. I'm going to give you a call later on.
Okay. Sounds good. So Commissioner Chair, I don't know if you just want to dispense with the roll call on our side. I don't know if you want to just dispense with the roll call on our side.
I'm amendable to anything we need to do. Shall we go ahead and do roll call to make sure that we're all
Yeah.
here? All right.
So because that
Let's go
it's
ahead and do that.
time consuming. Yeah.
Okay. Roll call, please. For the-
Yes, good morning. Madam Chair,
Present.
Vice Chair,
Present.
Mr. Commissioner Adekai,
I'm here.
Ms. Commissioner Phillips, Ms. Phillips,
I don't think she's on.
thank you. We
Okay,
have a quorum.
Okay, thank you. We have a quorum from the Navajo Nation Human Rights Commission.
So 1, 2. How many? They have 6. They have 6 council delegates, so 4 would make a quorum on their side. 1, 2 for sure. Not sure who else is on.
Honorable Slater, are you on?
Yes.
Okay, this is Frank Adekai. We live in Albuquerque. We probably have never met, but We were very close to your mom, Faith, and we lived in Chinle for quite a long time, and we were very close to Bob and Ruth. In fact, when he was the superintendent for the Chinle School District, I was on the Board of Education, and we traveled quite extensively to Phoenix for different reasons. But one of these days we'll meet.
It's a pleasure to make your virtual acquaintance. And yeah, I look forward to meeting sometime. Do we have any other HES committee members aside from Shanella Paul Begay?
Good morning, Mr. Mose. Are you on?
Morning, sir.
Good morning.
Morning.
Hey, good morning. Joey Slater.
Good morning. I think we need one more and then we'll be ready to go.
Okay, I'll be on standby. This is Delegate Daniel So calling in. Sorry I'm late.
Morning, sir.
I'll let it happen.
Chair, you have myself, Delegate Halona, and Delegate Begay on the line. And then there's a quorum from the Human Rights Commission. I think Mr. Gorman, Dr. Jeanette Dale, Mr. Adekai are on. And I think I missed someone. I apologize.
Steve Darden.
Vice Chair Darden is on also.
Apologize, Vice Chair.
Okay, thank you, Cecilia, Vice Chair Slater. How do we best proceed? Do you want Chair, Madam Chair Danette Deal? Originally, for us, it was a request to have a joint meeting. And
Yes.
then there was some mix-up to say it was a work session. But I really want to conduct it in the manner of a joint meeting to give everybody the opportunity to be at the table at the same level, and rather than just having the committee be the main folks. So in that manner, why don't we do a call to order, and then the staff at Human Rights Commission will do the roll call, Hess will do the roll call, and then from there, then we can proceed with invocation and introductions. Would that be agreeable?
That sounds good. Delegate, so let's go ahead and do that. And we already did our roll call, so.
Oh, okay. So, Mr. Mose, roll call, please.
Yes, sir. Morning, everyone. Honorable Paul Begay Jr.
Delegate Paul Begay is present.
Thank you. Honorable Call Russell Slater.
Delegate Slater, present.
Thank you. Honorable Pernell Halona.
Halona is present.
Thank you. Honorable Charlene So. Honorable Charlene So. Honorable Daniel E. So.
Present. I'm here.
Thank you, sir. Honorable Edison J. Winika. Honorable Edison J. Winika. Chair of 4 members constitute a quorum.
Okay, thank you. Committee members.
Okay, we did
We're
our,
now
go ahead, sorry.
the invocation. And in this aspect, I'd like to, if Brother Honorable Vice Chair of Human Rights Commission, Mr. Steve Darden, if he could do the invocation. I don't want to step over Madam Chair's authority, but that's just a request.
Sounds wonderful.
Okay, Ashnan.
Oh,
Ko sleep with Saske Doho. Notsko. Heat Anike out Latnans Lashes. On a started a yacht at Dilsen. I started a yabi suhins in the Koshi. Later is in the Yale keep only. I had a horizontal only. Nema. Sa, 16 of a card or shit and it's not Kate Haya. Under the odd and he tried the fish. Under the odd, it's just stand, Kodot, or sleep, the chillet, and oi, just the guinea, get the idiot, and Tascado. But I had a din sad in hitching, so none of skis over, he can not all the Kodoya, so do a larger cut a window, Sassiki, hate, I thought a window sass. Under that toy stand to the guinea. Under the highest cast, zone go, not or under the other Chaskis, the Hama. Under the hash, Kodochi, Yash, and Yaniki, None is so, Nakai Zidigi. Oh, Hashil son of the adult kitchen, you know, she cut a din sabe, I did Sago. First, then Yaniki, under the other, and he caught at the Klege, but Kato Asanini has stay a one. Negan has urged beside me on in the kitchen, he talked and he nalak. Under the odd and he naked at that there's urged to spin it near. That's all. Get the chili, get the night. At on the Joshi. Kodobes another he did, need of his ladder he did start all this. And the odd and not that guy excuse, not that you 8 could be killed on it. Karatin bedenov is on hidot asanti tanago karatin bedenil is on he can naslin on he dad naslin he sees naslin he naslin can need naslin he not naslin and the other he has us naslin how hon he says on he keda he yag and he kicking he not that's what and the he zede cannot hold on to Need citizen, they saw any legal hit at Neil George with a pond and on or leaf, but not out if he can hit the nap. Did late or chilly, did late a sign him about Alligita.
Ashin soba chopa initsin. Akodina is nacha sindigi. Jachi baki the kid. Jachi 1,000. Jachi be yata hoye the corner. It's all dollars. None of the donation. Banana. All the banana. $8. With some days nishigi. Nakhandad nishigi. Bad it inigita. Suyat it. I hit that news. Jordan. He told us a nati. Let the long part. Has not. And then later study yini. Just not in so just talk or sleep the bench or just not or even card that and not that but not cut that but just not that we can't be it. You that class eight is a class eight not yet not if you not for sound of it. The young child if you not dance not that of is not dancing. Not that class A now using that offer that A. And that's zepet. Bepet the bebet that they non for sound of it. Na yaad echt en ninico, yaad echt out niet, na de net echt al is ook gewoon. En naba de hazoni, gewoon geen dat is, geen dat is. Gewoon gaat kina de ido, dus yaad echt al gewoon. Het goed, ja gewoon, gaat het die boos kiels, maar gaat het gaat die met zaken geschiedenis, het gaat die met. Ja, bij een niet, ja gewoon niet, hazoni. Ja, bij yaad, ja, het is gewoon na die stad is niet, wat is het? Nou weet je, zo doet je het niet tegen komen. En nou joh, dat. Oh, zo nog hartstikke, oh, zo nog hartstikke, oh, zo nog hartstikke. Oh, zo nog hartstikke.
Yeah. Oh, potato legs. Oh,
Shiaj, this is Delegate. So I'm on the call.
oh, Kusila Sapiza. Yeah. Thank you for joining us. Committee members and commission members, do we have any announcements that you would want to put before the joint meeting? Okay, there being none.
Jericho?
If I may take privilege, sir, this is Commissioner Steve Garden, Vice Chair of the Navajo Nation Human Rights Commission. Adada Nato Museum of Northern Arizona has ando Dodge a care Jadi Benikaj Kojo Shata Archigo Doha Apachigo Ajo that the Tadazanye. Brophy College Preparatory School, David Ocho, because only host of the Phoenix. Then ya LT had actually ya answered that there's kids or ya they skilly. I don't see Yolanda Isley, not on exchange and Lenny all copies in the street, Yolanda Isley or AD. Protecting Oak Flats, they snow. Oak Flats, they just can't and Kaya. She ya the Kaya has ya not on it and Lenny they yo yaski, but not at all. What they la Kaya. State of Arizona, though, they can not great actually. An international mining corporation from Australia and New Zealand to mine copper on that sacred area, sacred to the Apachean peoples. I'm really proud of the Navajo students. The majority of the students are Navajos. They made that decision to do a prayer run, wearing shirts that says protect Oak Flats. I had the distinct honor and privilege to do the blessing for them yesterday morning. So they made it all the way to the south side of Payson to Tonto yesterday. To the Benashin, Kanati, Jade, this afternoon, wherever their destination is at that Oak Flat. Yeah, only these artists as a member of the Navajo Nation Human Rights Commission. We consider this a human rights violation of Indigenous people's sacred sites again. Mining interests and extraction industries interests over Indigenous spiritual values. And the fight goes on. I'm really proud to say these young Navajo students, they made the decision to do this and leverage the administration of Brophy College Prep to do this. Hey there, yeah, I'm sorry if you're on the
This is Jennifer Dale. I also just want to note that the Human Rights Commission will be having our regular meeting on March 5th at 10 a.m. on Zoom.
Oh, Jonah,
Chair, so
oh,
I apologize. This is Delegate Charles Newton. I am on the call. I just wanted to let you know ahead.
Bashila, yes. Thank you for joining this call. Committee members, anybody else that wants to introduce themselves that are, know that there are others that joined us, so please announce yourself.
Chair, so Delegate Paul.
Oh, Shache, you have the
Good morning.
teleconference floor. Oh,
Good morning, Shache. Thank you very much for allowing me a little time. Members of the HESE committee, good morning to you all, staff, Mr. Mose, Ms. Beverly Martinez, welcome. Audit board member, Naflingi, Human Rights. I just especially wanted to thank my brother, Lydia, Citizen Nahalia, Mr. Steve Darden. Doba Hatenson do Asian Bikahshin, who Nase Dahwit Ado Leso, if it's not a wheel let or Leso, Iba Hatenson. Just wanted to mention that every now and then a certain prayer will hit your heart and restart your kind of be nasna anajut eko oye hot ego ye ban tda case of an additional addition ya John gon say that after the in kitalo dole. Thank you, Chair.
oh, Shache, John without. Citizen Igi. They ho Igi O Hewinson. So who else would like to introduce them that are part of this call?
Good morning.
Okay. Good morning, Leila.
Yate Bene Shanant the Cora Max Phillips edition. And I got on rather late because I was trying to finalize a document. We're having a meeting with one of the congressmen that was preparing a document for that. So Ado being between the and slid or nash as a trapa habashin. Tadish Gijni, that she chedo, the chifit the net would eat me. But she not like what out a son and shleko. I'm happy to be on this call. So I had
Oh,
Honorable
David.
Derek Daniel,
Oh,
this is Frank Atakai.
yeah, Dave.
I can't, excuses on those, I shouldn't have seen Frank Atakai and she. Nan is yours, Holgero has thought that's a supply actual. Can what con hold, yeah. And deck a day, I can hold on a day, neither. Hardest can hold on was out with the strong for the people. Though had other ye had that zeta. I got best dealers in the relation, as she's on a best. As that Dino at a binach, see, yeah. The Hatchin tra. Dikoje, Danish. Trahat a list, she sneak or could go, she could that easily. When I had that, Aje, Tatanetta. Eddie could just allow that I catch ye, Aje. And see all this. Hala, Aje, I could ego be in la. The Shrini or could ego, ya. Now, the sheet crash Slater all this, Dina, Hadget. I could go, yeah, then. Na best an gaan as na li a che but all a got edo list that no what ask that was need over ego but that's what see college in it and it na kaide na but she chain kia on it and the cherots sana juned and hinala out ego na kazata ni ego na maron na de oje at seto best guy a coco a date or a cat, you sneed all this, you could walk. It seems answered all that. A cat,
Akwesila, Commissioner Atakai. I say, I guess the other part, fishing couldn't still has all the how deals in. Just say, Daniel, so that's a journey. Kenzikin and slow. None is as a touching, that's a chain. Such Christmas, that's a chain. Now, Barney, that's another. Don't lay not nails in the Adam here, the whole. Cut out the Kachi Kunde cut be seen the area. That's Tunnel A on the con. Ko egg need see but they go. Nasta seat clean without area. So ni kedo ni no kedo holdo. So eba I think so. So yeah, at shit though, but Nasta stop. Ikea hadiba. So ba hayan dole. So ajo. Ya tehwe. Ik ga kid in dole fi given ya. A date, So ja die. De nebbe Washington wil hegi zo to kanaal dole stato. To ke hazo ya unzen dole. No staan. To zo ba huilen dole. Jo het niet goed ba huilen dole. So even been the chat. Ye dahina. Ko kwai ki ya. Chatoba hasti kashibo. Hasti in the kunde kwai Chato ba ono sendoli. Edo sidane tezene. Ko kodo. Chile. Honorable Vice Chair, your turn.
Good morning, everyone. For those of you who don't know me, my name is Cora Slater. I'm the Vice Chair of the Health Education Human Services Committee. Adonai Nishlinagi e Keani She Sontane Bashichin, Senajini Dashachero, Sontane Dashanoa, Senekana Dant Nasha. So I live in Round Rock, Arizona, and I represent Round Rock, Rough Rock, Rock Point, Wicochucay, and Saley Whitfields on the council. Thank you.
This is Jennifer Danette Dale. I'd also like to introduce myself as the chair of the Navajo Nation Human Rights Commission. Jennifer Danette Dale in Shlon, Logan Shlon, Ashihi Bashashin, Kilachini Dashache, Toha Lili Dashanale, Tohach, there I see that Nashado, the Bebetwa Walieda. That is where my grandmothers returned to after 1868. And so we continue to live in that same space and place. So I'm also a professor of American Studies and a historian at the University of New Mexico.
Lebanon.
Shishi, that day on the floor. Say, Pernell Halona and Shia. Shia, it's a land zone. Torch English there, Ashe Bush's chain and stage that should say 200 Dacinella, 8 out the Nansle, District 14, a base bounce on a nasness. Pohache do Nash Edo, Nakai Betro, my cake to Aro Bas just in our snesh. Base bounce on. Yeah, long. Chair, Delegate Paul Begay.
Okay.
Thank you, Chair, members of the Health Education Human Services Committee. Welcome also to all that are in attendance to this virtual meeting, staff and our assistant. Paul Begay Dashichin Ado Coachina ho Costo Hen Hall Ade not Benia Nashating Kyon Ade Nabanasha Beshka Gate Lichi Kabi Tona had linked to Naban Sabatin Ade Beshmas Anenschle Sadish Gijin the Ainschle Adosh J Yapi Petoni the Aidanle Adosh Chi for the Chini that Shinalekia Ani Ya Ani the National Division Uncle Ego at the Nanschlido Sheha he is in a shade in a way Sakonholia Tonanes does the door Ado shut up with John Ajo Kis Ani Keda had a bit seed the Ade is in a Shahawal Mesa Coleman Mesa Holia Conda Betinchnani Bishka Gidona Rago. That is then what Saholier, the Ade Howan Il. No, Kodoi Nation Shako. Bashin, Sando, a share, do Yakati, Yadish, Dahil. A share, chair so.
Oh, Kailanon.
Yeah, this is Delegate though.
Oh, what's she?
Oh, yeah, ben on for arat she so the Zembaching Ziggy a Sabahensen. Arat Shuja Charlene so Twasakonde a Nasha a Queshagan. Arat not that the net and straw, but any bushes chain touch she need I should shake the cheating the shanelle. Arat Bana Shaggy a NSA a son. Arat na to a Mexican water. Arat decision a red mesa. Arat isas bus. Arat aqua at Twasakan sweet water. Aqua a hat and get the schneedle. Thank you for being on the call with us. Hat yash.
Honorable Wanika, have you joined us? Otto, Madam Chair, Eugenia Charles Newton.
Oh, yeah, Otto, yeah, a bin. And so there's an in la Otto and Jania. It was really nice to hear the way that you said your prayers here this morning, and Chicago. Otto, colleagues, good morning. Thank you for allowing me to listen in on this meeting. I felt it was very important. Dona and Schlinigi a bit asni, Otto, a she bashes chain, Asche should change go by Chanella. Bish, but it's Annie A and Schliss and not Annie Nesbach. So I represent the largest community here on the Navajo Nation, which is Shiprock. I look forward to discussions today.
Oh, Basila. The formalities, Iggy, for continuing this, and please excuse commissioners, Janantai, the formalities of doing the reading of the agenda, proposed agenda. Miss Miss Martinez.
Good morning, everyone. Agenda of the Health, Education, Human Services Committee, 24th Navajo Nation Council, special meeting joint, February 26, 2021, 10 a.m. Place, Viva Telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation, announcements. 2, recognize guests, visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals. 5, receiving the report. 8, discussion relating to elderly care centers on off Navajo Nation and accessing state alcohol taxes for behavioral health and mental health services. 6, old business. 7, new business. 8, other. 8, close the meeting, announcements adjourned. Mr. Chair and members, the agenda has been read into the record.
Kushila, also presiding would be Madam Chair Jennifer Dinette with the Human Rights Commission. So,
Delegate So.
oh,
I'm not sure at what point where I would make this request, but I would like to ask that the heading of the agenda include the commission and a joint meeting with the words joint meeting and the names of the commissioners to be placed on the agenda.
yes. Ms. Martinez, please make notation that it is a joint meeting.
Mr. Chair, I would need an agenda sent to me to incorporate that. I was never sent an agenda from the Navajo Nation Human Rights Commission, Mr. Chair.
Okay. Madam Chair, could you just go down the list of the commissioners and
Okay.
it will be incorporated?
Okay, we have a quorum here. We have our Vice Chair, Stephen Darden, present. We have Commissioner Cora Phillips present. And we have Commissioner Frank Adakai, present as well. So all the commissioners are here as part of this joint meeting.
Including yourself.
Yes, including Chair Jennifer Danette Dale.
Lucila. And the title of the meeting will be, it's a joint meeting between Health Education, Human Services Committee and the Navajo Nation Human Rights Commission. And pardon us, so we've been, I guess, FYI, the council was in session till midnight. Might be a little
Mr.
slow.
Chair.
Yo.
Mr. Chair, excuse me again. I would need an agenda to attach to this agenda and then incorporate both of them like that, Mr. Chair.
Sheila. Cecilia, Mr. Leonard Gorman, could you facilitate and introduce yourself? Hey, Leonard Gorman,
Commissioners and then Chair of the Health, Education, Human Services Committee. Ya kinaznin shlodishchini bashichin. Asa agenda con zondolish to a joint meeting at the title leaky Navajo Nation Human Rights Commission bosso adonda or joint meeting was there instead of special meeting. Ado qua list of names iki biyagon Human Rights Commission busy iki bosso. Okot asa agenda law binach ya lindo lih. To tata da yan hila agenda deliante yat asati la lake echo ya. So acquired to bahazan go down to asa agenda con zondo lindente.
Hakoshila, committee members, in adopting this agenda, the motion should include the changes as recommended by Executive Director Mr. Gorman, as well as the request from Madam Chair Jennifer Danette Dale. Committee members?
Chair, so Paul Begay.
Oh, Chair, you have the floor.
Thank you, Chair. I would like to make a motion to adopt this agenda with the inclusion of the agenda being considered a joint meeting between the Health, Education, Human Services and the Human Services Committee, with the inclusion of all members that were mentioned in the roll call. That will be my motion, to modify the agenda to make it officially a joint meeting. Thank you.
Second, Halona.
Oh, okay. Those, that's not us. From the commission, you heard the items to be discussed. Did you folks want to also add an item. I think previously we had talked about sacred places.
Mr. Gorman?
ADK, Jotkat DG, Commissioner Phillips, Cora Phillips, I see Yana Nisbishia. Without Ancient Island, I advocated Nia, Ibini Nano, Kwaege, at Ahnet, not Nadland, Ajago, Bijago, Banana Seal, Iniki, Nihijeko, at Ayodabla with the Nil Zek, Naspede Nil Kal, a quiet art so the belt and I see so Ayat Etolilko. It's up to the commissioner to offer an amendment to add that item on the I guess discussion item that's listed. I see motion that was there the boha.
Commissioner Phillips, do you want to make a motion?
She's on mute.
*6.
Commissioner Phillips, do you want to make a motion to add an item to the agenda?
Hello?
Yes.
That was, Madam Chair, members of the committee and the Human Rights Commission. If that's what is being recommended, I was not ready for that, but if that's the recommendation, then I would like to go ahead and proceed with a motion to shed some light on the Doko Osleed issue that we have been working on from the Indigenous Circle of Flagstaff.
I'll go ahead and second that motion, Madam Chair, to add that as an information item.
Okay.
This is Commissioner Darden that made that second.
Okay. What's the protocol here for adding that to the agenda? Is there?
Committee members, with that, let's vote on the amended agenda. Mr. Moose.
Yes, sir. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Wanika. Honorable Edison J. Wanika. Chair, I vote of 4 in favor, 0 opposed.
Okay, and then let's put it on record for the commission to also vote.
Okay, commissioners, vote please. Vice Chair Darden,
Aye.
Commissioner Phillips,
Aye.
Commissioner Atakai,
Aye.
okay, we have 3 yeses in favor of the agenda. And I vote
Thank you.
yes also.
Okay, thank you, commissioners. Ms. Martinez, make sure the votes are tabulated for each of the members. Mr. Mose, same way. Let the record show the commission voted in favor, 0 opposed, and that the HES committee also voted 4 in favor, 0 opposed, the chair not voting. Sheila, there's no journals for this particular.
Chair, we can't hear you, Chair.
I'm sorry, what was
Oh
the,
dear, I'm on remote and mute. Basically, 5A, receiving a report on the elderly care centers of the Navajo Nation is the actual topic. And to give some background, the Navajo Nation receives monies from the Arizona Agency on Aging, that receives money from the New Mexico Agency on Aging. And so the Navajo Nation has a Navajo Area Agency on Aging. There's state sources as well as federal sources. And part of the requirements in accepting those funds is the fact that they're supposed to have an ombudsman. And that position basically advocates for elders, no matter where they are. And in this case, for the Navajo Nation, the committee has received information that ombudsman position hasn't been filled since 2002. And in a period either somewhere around 2007, 2010, they wrote that position out of the budget. And so the committee had received a real concern notation from the Honorable Thomas Walker Jr. from, he represents Bird Springs, Talani Lake, Loop, and I think it was Cameron. And he relayed the information that we all read in the Navajo Times about a facility in Winslow. And so Navajo Area Agency on Aging, they're saying we can't do anything about it. The Division of Social Services, through the acceptance of 93-638 funds, places certain elderly in that campus of care facility in Winslow. Because they're off reservation, they're claiming no regulatory authority. And so that's where the committee is looking to the commission to basically gather information. And I guess for me, I just don't want to just, accept it as a report and then move on to other issues. This is a very significant issue. And so far, the executive branch hasn't said anything about it or hasn't expressed concern to the state of Arizona. The state of Arizona has monies that comes from access, the Arizona Cost Containment. I can't remember the full name. And then Arizona also has Arizona Adultex regarding aging and long-term services. So they have regulatory authority oversight over these off-reservation facilities. And so that's where we're in a dilemma that what would you say, the committee has exercised as much as we can. The committee will be asking for funds to do a performance audit on the department and the division. But that's going to take time. In the meantime, there is the appearance of a lack of care, a lack of concern. But what Mr. Walker relayed was some of the relatives weren't immediately notified on the passing of their relative. So and viewing the past performance of the Human Rights Commission regarding what occurred in Albuquerque, that has brought about positive results, and the acknowledgement that there is problems with the Albuquerque public schools. So that's where we're looking to the commission to help take up some of these issues. India joint meeting Human Rights Commission. That's the background.
Shanala to Shananta Chair, so Ado Vice Chair Slater, Ado SC Commissioners, the Steve Darden, Vice Chair of the Nomination Human Rights Commission. Shananta Dr. Netdeal. O Commissioners no Senegi, Dishin here. Not as the Rosa need long, she Aja Nahabi thought so. Agenda again. Though whatever data is already available. So there is a report that I remember reading as well, and try to, through the Freedom of Information Act, that we can ascertain or request formally other information related to this. Sadly, these off-reservation communities, organizations, they're willing to take funds to care for our people, but we all know and we've all heard allegations that they are not prioritized. So it's a done the hinny based eggy, oh, a young hit about the Hanada. So it's a done the hinny based eggy, and hit a Vicky they steed. I am not when he hit the any given in the Human Rights Commission, but talk at Quizania dancing. Jashi, I thought your strategy sessions are based on the Chinese about the Chinese thoughts. Commissioners, when we first started to review what would be our strategies that we would put into our vision, our mission statement, one of the things that we resolved was that wherever there were deaths of our Navajo citizens, especially in the off-reservation communities, that would be priority over other issues. This is one that fits into that area. We understand that the Navajo Nation on-reservation entities can say they don't have jurisdiction, they don't have the authority, but we can do things. We do have a memorandum of understanding with the city of Winslow, which I think can give us leverage. We also have a new mayor in the city of Winslow that I think would be willing to work with us to ascertain what we can do to get a positive resolve for the relatives of these people. In our next agenda, Mr. Gorman, I'd like to get my fellow commissioners support on that. To gather that information and to find out the process that might be available for us to pursue something, or it might be incumbent on the individual families that have been dealt losses for whatever the reason, they're COVID, and there's other like Flagstaff, the Senior Peaks Care Center. They didn't have that circumstance and situation, and I know that they have a lot of Navajo citizens there as well, and other facilities here in Flagstaff. So just have to make an assumption that there was not the level of care that was due to our Navajo citizens there. The Human Rights Commission has experience in doing those kinds of things. We'll have to work with our staff because they're tasked with a lot right now, but somehow, some way, we'll work it out to bring this forward to our agenda as well. Madam Chair, fellow commissioners, like to have your support on adding that to our agenda and bring the appropriate parties to give us guidance on, what are the statutes, what are the policies of and other legal factors that could be brought in. Again, there might be civil suits that might be brought by individuals who lost loved ones, and that's up to them, of course. And there might be criminal suits too. I don't know what our Navajo Department of Justice will do with that, if they'll even consider doing that, because there's a large class of Navajos that died as a result, at least according to the Winslow Care Administrator, due to COVID.
Hello.
So,
Can you hear me? I saw a sign that I've been muted by the host.
if you're on the phone, *6, and then, of course,
But
but
can
go
you
ahead.
hear me now?
Oh,
Okay, all
right.
right. This is Commissioner Phillips. So, yeah, nanate shananta kwa asasit legi. I hold this issue near and dear to my heart, because we've always stated that, the elders, they're the cherished wisdom keepers from the past. And so I had the privilege of talking with somebody from the Arizona Department of Health Services, and nothing really new came out of that conversation beyond what we, I think to a degree, we're already aware of. And Commissioner Darden already expounded upon those concerns. You know, we live in a Republican state, the state of Arizona. And a lot of what we hold here within the boundaries of the Nebuchadnezzar, you know, it's undermined by state statutes or what have you. And I remember one of the past employees from Navajo, he stated, you know, there is an iron curtain that exists between the 22 tribes within Arizona and the state. If you look at what that iron curtain means, you know, other than the mandated federal funding that has to go through the state. So in other words, you know, what I'm trying to say is, you know, we live with the ongoing systemic racism, institutional racism, discrimination, and so forth, you know. Nothing much has changed despite the civil rights laws. So, and I say that because, you know, in my conversations, I've learned, I am reaffirming that Arizona Department of Health Services really has no priority with Navajo Nation. And this is coming from an insider from Arizona Department of Health Services. And so I had a lot of questions on that, you know, in terms of formulating some strategies as to what we can do from our end. So that's how this person from within saw it firsthand. And so rural settings are given the last priority. And so these were some of the questions that I had. Are nursing home private corporations? And if they are, then what type of benchmarks of oversight and supervision, if there's any whatsoever? Because this Department of Health Services, they're the ones that give the licensures to nursing homes, the medical care facilities, behavioral health settings. And so this is where it was iffy, but, you know, because they're issuing the licenses, you know, to nursing homes and other facilities, then they're incorporated by the Arizona Department of Health Services. And so the bottom line question, which I never really got an answer, is, okay, if Arizona DHS provides the licensures and the incorporation status, does that mean that they're out there on their own without any kind of monitoring, supervision, and regulatory measures that's a big, hardcore question. And so from what I've learned, number one, her name is Cora Phillips, and I had the opportunity to meet with her at one point in time. And so what I have learned is they're trying to monitor without adequate staff. They try to address issues as they arise. So very little monitoring is done. And this is coming from the insider. And again, you know, that rural settings are given almost very little to zero priority status. So that's, again, just reaffirming and learning new things along the way in terms of where the nursing homes fit into the overall structure of the medical retirement community and overall healthcare systems. So there is an agreement with the federal government to where Arizona DHS functions on their behalf. So number one, they function under the Arizona statutes. And then they get the funding, which is Medicare, Medicaid, and the Arizona Long-Term Care, ALTEX, the funding. That's what is paid on behalf of the elders in these retirement homes, nursing homes, and then when they go to the hospital. So, so another question that I had was, what are the criteria, if any, to revoke or suspend their license? I didn't get an answer. And the other one is, what institution does the accreditation for these nursing homes? Again, I did not get an answer. So those are critical questions. And if the Human Rights Commission is going to pursue this crisis issue, then I think that those are questions that needs further ascertaining. And so the other thing, the interesting thing that I learned is that number one, within Arizona DHS, any issues that arise from rural settings or from, tribal communities, she will end up supporting her staff because, again, there's zero priority. There's really no interest in these rural settings. And so the other question, or let me get to that later. But getting back to Navajo, I think that Navajo Nation has really put itself in a self-defeating purpose when they decided to eliminate the ombudsman position. If anything, they should have strengthened that position because, again, we live in a Republican state and we see it out there on a national scale that they have very little interest in working with colored people, and they will try to undermine us in any way possible. And so that's where Navajo Nation, instead of being proactive, they put themselves in this self-defeating position. And so we all know that, politics can be ruthless. And everyone out there is fighting to defend their interests. And I think that that's where Navajo Nation dropped the ball big time. And it was the worst thing ever. And it would be considered negligence. So, but here's a question that was posed to me. How is the relationship, or what is the relationship like with President Nez and Governor Ducey? Because it might have a bearing if we're going to get to Cora Phillips. She's the director for Arizona Department of Health Services, that regulatory department. This issue, when brought to the attention from Navajo, it will give the prominent attention that it deserves. It will only escalate if Governor Ducey calls on it, because this Cora Phillips, she will run behind the governor. So I think, again, within the internal observations, they take care of each other's, and they will drag it on and on. And I think that's where we need to come up with a very, very proactive, give it a strategic direction. And the other thing that was brought to my attention is they will try to silence us through their laws, use that divide and conquer mechanisms and so forth. So, I think that internally within Human Rights Commission, I think that we need to just really be fixated within or regarding the strategic direction that we're gonna have to give it. Like, for example, using the media, and somebody mentioned lawsuit and so forth, meetings with the governors to see whether it's going to fall on deaf ears or if he's going to be proactive along with us, Governor Ducey. So that's what I would like to elaborate on from the onset, and hopefully further the discussion on this issue. So thank you. Yeah.
This is Jennifer Danette Dale. If I may speak, Delegate So.
Yes,
Oh,
you can speak anytime.
okay, thank you. Hakoshi. I would like to add to this discussion first by saying that this is I believe it's my 10th year on the Navajo Nation Human Rights Commission. I'm the chair for the second 4 years of its term. I have been very satisfied with the work of our commission on behalf of the Navajo Nation and our citizens. Our commission, our staff, we put a lot of stress on them in terms of our expectations of the work that they do. I just want to, point that out, and that as our vice chair Darden pointed out, we can place this on our 4-year strategy plan to support and facilitate the decisions of how we're going to proceed on this issue, which is a crisis right now. I do want to caution and raise questions about how much of the information that we want to share publicly, that there are things that we want to talk about, particularly strategies to move forward, that should be conducted between the two committees, so that that we do these things as we need to, and not raise questions about certain kinds of things that need to be done privately. So I want to raise that point. I am a historian, and one of my areas of study is border towns and border town violence. The storyteller Sunny Dooley published an article in which she wrote right at the onset of the pandemic. And one of the things that Dooley said was that for the Navajo Nation, at the conditions of our lives, particularly under this federal government, what was created for COVID, the monster to come, was that the perfect body had already been invading the perfect body. Okay, we were already, the conditions were already there, set up so that we would feel the effects of the virus as we're feeling now. So when you think about what Commissioner Phillips is saying in terms of what were the conditions at that nursing home, speaking about the Winslow one, where we had the deaths of 40 elders, those conditions were already there that led to the deaths of our elders. And so we want to think also about what those conditions are, how we approach this in terms of evaluating how this happened. And then the second part that I want to talk about also is that we often talk about, people often say that this is a moment, this is an apocalypse, what we're going through right now. If conditions leading up to what we're facing now were less than favorable, that our people are living in dire conditions already that would lead to what we're doing, why are we being nostalgic about the past? How do we take this as a moment to take care of our elders, in which we express in our values, but obviously we're not doing this. And so as part of our strategies of how to address this crisis, I also want to have us put in place a way to start thinking about the future, to show and ensure that we actually really do care about our elders. And one way that we're not showing care is to put them in nursing homes. Those of you who have cared for your elders until they passed, like I did, my family, we took care of my dad in the last years of his life. We took care of him always. And then my mom passed away right at the beginning of COVID. We did her care in my home until she passed away in my home. And those were not our hopes, that we had hoped that they would recover. And so how do we set up a system based on where we return the care of our elders back to our families? How do we facilitate that kind of network, of that kind of guest system, instead of relying on border town nursing homes to do what we should do? And so there's two things here then that I would like us to consider. One is the strategies to address this crisis at this moment, to listen to the families who have lost their loved ones, to listen to families who have their elders in these facilities right now and their elders are isolated, and to listen to how we do better, how we take back control and authority so that our elders are at home, instead of constantly creating the economy of these border towns. And so those are the two things that I want to add. I would like, if there isn't, if Commissioner Adekai would like to say something, and then I would like for our Executive Director, Leonard Gorman, to offer us some guidance. Okay, Mr. Gorman, do you want to go ahead, Commissioner Adekai, and then Mr. Gorman.
Mr. Chair, for the Health, Education, and Human Services Committee, honorable delegates, and the commissioners. Many times in my career, I've said what I'm going to say. I spent 4 years on the Behavioral Health Planning Council for the state of New Mexico. Governor Richardson appointed me to a 4-year term. And I saw what was going on throughout the state. We had all kind of professionals on this planning council, PhD, masters, and so forth. And social workers, behavioral health professionals, we're all on this commission, the planning council. After seeing what I saw, I would get up to address the planning council. No disrespect to the delegates, the honorable delegates that are sitting there. No disrespect to anybody else that might be listening. But if you think about it, you can more or less generalize and conclude this is how we live. Whether you're living on a reservation or outside or elsewhere. And this is what I usually say. It is ironic we live in a crisis-oriented society. Let me say it again. It is ironic we live in a crisis-oriented society. Something drastic has to happen before everybody, ones that are in authority, ones that are local levels, wake up and say, hey, we better do something about this. My take on that is, what about before? Proactivity words were used. What about before this tragic event happening? And if you just kind of sit there and wonder, your own community, what's going on? What do you have that needs to be addressed? Or do you wait until the road washes out and say, hey, we better do something about it? I heard the contract was done. And I heard the words overseer. But in this area, the human health, education, and human services comes into play. Whenever the contract is being affected, I've heard the word, the number 638. I'm familiar with that. When it is being drawn up, there are important principles that are incorporated. And what's one such thing as who's the overseer? Who's going to take a look at what's going on? Not on a yearly basis or a quarterly basis, but every day. And then also submit reports on a monthly basis to say this is what we have. You have your social services that are sitting there within the Navajo Nation. We have your behavioral health people that are sitting there. What are they doing? Are they waiting for people to come in to see them in their office? Or is there a program where they go out into the communities to see what exactly is going on? I hear about the Chinle Elderly Center and other centers that are within the Navajo Nation. And then, of course, outside the Navajo Nation. Instead of concluding and saying or asking questions and blaming, that's what we are used to doing. We blame, blame, blame. What about us? Why can't we stand on our own 2 feet and do something about these things? I'm new to the commission and I'm observing to see what's going on, to see what is being said. And I do submit a monthly report on what's going on within the law enforcement sector. Not on the Navajo Nation, but the border town. I sit on a commission in city of Winslow. And I submit a report every time we have a meeting to address what discussions we might have had. So I'm trying to get the same thing to be done with other commissioners, to where they can submit a report, and instead of just generalizing and saying this is what's going on and so forth and so on, and we need results. So thank you so much for listening. And if you want to talk any further, I'm always available, and I'm retired. I've been retired over 22 years after putting in 37 and a half years in the criminal justice system, 8 years in uniform, and 29 and a half years as a federal agent. I started my career there on the Navajo Nation back in 1960. I was a rookie officer and I was stationed down in Lupton. And then from there is when I started. And I was a district captain there in Winter Rock the last 8 years that I was there, the 7th and 8th year. And so I've worked with other branches, behavioral health, social services, and so forth. And I worked with the Navajo Nation. And I appreciate all of you doing what you're doing. And we'll be talking. So thank you so much for listening.
This is Jennifer Danette Dale. Could I have Mr. Gorman provide some guidance from the commission side?
Oh, Yate, commissioners and members of the council, the Health, Education, Human Services Committee. I just want to highlight some areas of effort that we are undertaking. And I have staff that are online that also can speak to many of these facets of how we believe as your staff to move forward with this request that's put on the table here. So I'll share with you my screen for those that are online. And then for those that are listening from the World Wide Web, Koko Ahidnek Ethodoli, Kadi Kwabenya, Asahiliniki, Jolsaike Ya, and Has Twido Sani, Bahayani Kedike Ya, Kon Tutnai Laiki, in all times Laini. So the first one, Niki, Edi Kinke, Kodona Nisit Hiki, Kodona Navajo Nation Human Rights Commission. Na kil cake at complaint Kilianite Isha. Ya Pedainil Nish, Zagit it as Aha, Capedainil Nish Isha. O Coco Zagin Ray, so Leha Hod, so that just it we so be a hod, so Gi Ada, Latin Hik Ya Nalso Sahinil. Die Siasent Sinais Excellent Kutzano, Leshi Ada Hayande. Okoko Ebenicht Ya Nasteya, die Jid. O Naide Kid Delia. Alla the Quider Lit a light or Liti. Kodo Nikidinabit is Ahiki, Yahanat Zahiki, Blush Line Lindigit a light or Liti. Kondet anarki na altså janjo nel. Østlat do leta di nind jan hitten hik ein linigi ja ada ja hatotze. Ilinde dat atonata. Og kondet at dit ahadenit edigi jo ajbik Argent has taniki do hada asichi ille. Jo hoinche nada kako hot egi do hondeligi. Og konne ya dainishkune. Aron rei kodel to gesita hot so that it don't also haja is not the modern watch ya banate into lisha. Oko kwegi to the Nahaban so case to lit. That council delegates Danosliniki not Ani Danosliniki Quake has all basically the Tinto, the Quash Hiliniki, be Tracy Credolis, Bahonitzenko, could out at the Nista Nitzenko, ya, be Tracy Credolis, Quaggy, ya, be Benikitchen, is Janet at the Nis is Shabahazenko. Okoko, they are there, just little hot soldier. Oh, Nissa down hot, Ada, Shinata. Jo kwenig eich abged has dient. Og aita basa has lead aita la. Og on hik ein lenigi big abged has dient iki. Aita han trate din a. Eni hikojin hi Washington je. Aita bebel ta honne. Aron dat a besto ag edan lenigi. Radit ahidot ahat hegi da e ya. Bilchot shashido adet tsudayat eko. And he'll show do after no can get a dick. Dot I down. Oh, what I thought is to go. I did I sat you thinking das netla. Isja. Aid I down at Jahod Zala. A coco a radit I you thinking das net. I don't stop was it in Washington, which you had a yilla. Dila couldn't he adenic aim that Kedokuta Nido. Could alla enda has la baho into no bears anik echo could la go that thought na it la di mobis kanya da shinakichinda and na it la di shena da ho da hon hitch and a daily yeah bella tash da ho de isja ada banat in a yab ebidol kash in rage large a bidol kala isja halet aban sokis are that the never Washington it I missed that lama dola now it's ita no han na yitla okay oh ne he ya Donald sos ngili ha dragi binilt ya sadai da radit I dan linit abel khatasit isja e ran hilisja nish ha dan a crocodile piper yele e yan here dit ahi tratanle e kojeda so leha hot soje just let we so hana hot so bin kaguna el kitchen da ye nela Navajo Nation Human Rights Commission versus San Juan County neni gito adin here dit ahi tanle a kwege ayo be da sit ada da nina DLA piper hard da e yahuda COVID-19 iki benicht ayoyan de kagistji it hegi benina nekej on sta ahit out I kanati ja no na yani de ja na yi e benicht benia da lasitli alet ada zum kan kona zati kwa I da but they need into na understand little question na hot is lila when also need te do I asan he esas a hot ego da tides nigi da da hol no stop ke on the credition and they shashi do it ego da na nesto listen na ni to need I da bonet za gon hit jo hot akwe ko junde your Kasigi Nasikal in late July this year. Ado is the ado niji igai nal sosiato nekokoko bohonat zato leko. I sit up with the note in court at skinso ho nasto lek. Okwa eke nahapan so case ada not ani no senigi. A quiet are you yet asked out that another. I don't ask him look at the door, not it ends and shipans as case could go. O quaike recommendation could do it out of Lika Niniki. Dila iota ada wind echo. Be had a seat zigulat up on that sun since Halana lan hit the net. They could so leho so thank you Pitahoti, Lato stick, okay. I don't da could Arizona Chico, thought Akunato, Nich, Halana Lan hit the neck with ego, a ya behoti, a double egg, Kate has stained. I don't Nini Kayish legit happy na. A thought ego, they got on hick is that journeys to slip, okay. Joke at the hot doses, ille. Yajudi Nanison Hatan, so Sindi. Binicht yat aitan yapita inis isha. O quantesto bahonitzi ada snide chairman so niji ilaya dados about 3 weeks ago ya data shows down this is. I don't know so stop ayot afalia. They couldn't he wasn't don't even count inishiki. Out ni adlanko. Aid I da deep in ye without egos twido sani ba ya ba hayato because ani beta date iki I da beta inish oh jay added I da sna ye hatzi I la to ya betech nina halko ata inish as now to halit our eliago Pohona Zado Lechua, Niniki, today die got quaggin, a kundla big, a lagon or days tico, de quagge, Judea Piper da, a bin cargon hundi do lechco. I said, anha, betenesh nago, do anhikepe so zigo, Njondo lech ischa, e quen he ni kid is ja quagge. Hard dialogue ben yago hutachet ido hutachet no ad nanjo ja ako nifata. Edigit at anawego yat a co quake. Edikin hapinol hat or lich when hapin in hinge kid nikinat anida no shiniki. Oko quite I nishiki to aita o hayugo da nish. Aita to contract the whole. Arizona DES ben kagunne. So the bohone zago da baka aje. Ya, o ilin koto, nzona ko ikalko, to onisto lehtichi, the la, o ilin, okay. A quante job has ani ilto willo. Bekek ahon nana nisto lehti ta. So dan kito no yan hata, quake. Dikit ada, kilka ne jakota. Bonnet Zado to illit aita Division of Health to Division of Social Services ikit aita bena nishiki o bena nishisinilla aita sinil kudona nishido lehiki shidani shido that ayat eto leh to illit Okwanda it said a large niliki nikikudo Navajo Nation Human Rights Commission niki ya Dina kinal yani deigi ben kagun skinlako hideto na ilink kodon he isja okoko shinai Daniel Soich in dan beltilas nils da ult khagi da shot hat zan hin kha niniki joy an he da basebas an no liniki bin da so ato bears ani dohla. Human Rights Commission da ino nishiki ADki adan the budget dan kidil alko a resolution so bela asli adana nishida lecho dan kiton nidi benicht enanis lekat in re shinj nada de shizu da shinde ya ko ashinal so sigi nich na tanal nato de ishin bazo Health, Education, Human Services Committee, Ben Khan, she a council as a and ende nato lili real ta niniki akwat egon ha or lago njondo li kudopan sa so members of the commission to members of the Health, Education, Human Services Committee akwat e yan ha ischanish lado lili ya she's not ta could
Oh, yeah. Ado ko committee members in Silchahot. So since to ato hot hot of and a quite since to sa night of kito in has uncut.
Council Delegate So, this is Jennifer Danette Dale. In terms of the recommendations that Mr. Gorman listed there, I would like to add or have a conversation also on 3 other items as recommendations. One, okay, am I on mute? Okay, I'm not. I would like to perhaps entertain opening up some conversation with our Navajo people about what it looks like to take care of your elders, what it means to put your elders in a nursing home facility, why we make those decisions, what are the conditions that allow families to take care of their elders at home, to ask for some dialogue and conversation on that point. Also, another point, a recommendation is to also consider a plan for the future in which we redirect care for our elders back to our relatives, back to our extended family. What conditions are created? And I know a big part of it is that we are immersed in a wage economy where people are working, children are at school, and it leaves no one or hardly anyone to take care of our elders. Is how do we begin planning to return our elders back into our homes to be part of our families? So I think that might be a recommendation also. And then the third one that I have heard discussions about, which might be part of planning, is again, this comes up of how few we have of nursing homes on the Navajo Nation. I think almost all of them are in border towns. So I would like for those to also be part of the discussion and also part of our planning as recommendations. So I think that's, I don't know if anybody else has anything on the part of the commission. We return it back to the Health and Education Committee.
Committee members, what are your thoughts? And before I proceed with that, Cecilia, she has it, Madam Chair. These recommendations, the summary, Ecuador baseball. So we have so many things rolling at us. Mm-hmm. A brief report goes. What on your site? What you've found and discovered so far out of Ecuador? A penacha esto kwagi a sato a basic single. Ado esto a naskol jesho that's we incorporate other folks. We do have Senator Carlisle Begay working as right now. He's an unpaid lobbyist for Speaker Damon to the state of New Mexico or Arizona. He can do the reaching with the administration. Out of those that are of attorney-client privilege, we can invoke that too when we also invite Department of Justice folks as well as Chief Legislative Counsel. Don't baseball on not being the ilk egi sato sabeta mahotit ahi Yelan Sleo. Quaggy Sato non national Hanimla. Abis Edo Nanigi. A change to Hazo Hada Bill Nisota. A core the Nachigi aya. I guess those aspects to make for justification for legislation. ADA Sato Bingadilnesh. Committee members, any other thoughts as as I initiated the response to what the Human Rights Commission put on the table? Committee members?
Chair.
Oh, Tatilla. Oh, welcome to the meeting.
So, Chair, and members of the committee, from the board, from Human Rights, and Yate Leonard. I don't the Banik Ingidani, it seems like what Leonard is requesting as far as support from the committee, I think is very important at this time. JB Ada those things, Nahanlen. Nika Shint Nahas Pudon is Zani, which in the Huitna. Jake Kadea Niki Bahani, so it are Nini and the Kadit Ocean Nenahano, Sanahan. Hajonas Karo Bahwin Stido. At the Queen Ion Yaitio. Other thousands and no Tada was keep on 8 Lake. Ako Adi Gira Nibe King Nika, John Lake. Do Dana Chair, we came there, so that's the just as I said, Naho Tiki is Nahade Nishiki.I is a Hanako. Tudosani, Kidas in the gate. Nle border town, so Ocon, but that is Neho. I see on Tantado, I say Sato, Tada, Haitao, Bada Hayangi, I see at the Huns in the gate. Jay Dana Hashin by Yanes Tea, and I really appreciate that, Chair. I got ADK. I saw a job house and I don't have key. I don't Banit on Jungle Lake. I think the leadership of the program, I said Satobe Naho team of answers case. It I set up on the date. I call ADI, you see a Hanago, you date initial. Doshi would only be now to the Dolitna, a quite I said I should be. I don't the D, Hashitao, Tanhi, Niki elders, Babu Yado, Nengi, Jada, and being his Zealand over Dadi, Kaki, Tanahan, and his Zadan, the Hut, Nihinan, Tinan, the Donna need Tinder. Nihiti Sadadi, Nihe Yane, Masando, Neche, Ne Nali that Adon, Madon, Hizeta. So that other I go back to William or better is Kasa. I could aim I could earn and hidden as Ka A be Casto. Kadena Toji in other Western society. A big out a company without question, it seems like we have to get more elders home, nursing homes, so that Aggie. It is a double carded, because they don't AB right. Don't unkin it. Jay Hassan thought Abianas at the detail a Hata Hasia, Yota Hino, so that it means that other pedestrians in Halanka. Because Tudon is on Ocho, the first of the Machi is found, they will Canada at Jake. For data opportunity to die say the between Lagi, Hashin, so 80 Bakat in her long call to end the dot I about 18 to ta shi bi ke ti da jo ni to fa yu ko fa da ta ga ta shne ko kha da jo ta so pa sen ko pe ya ho te ho na ha kha do le na tu zhen zhen ta ko ta da ti so pa sen no pa ya ho ta ge dan le ho wa pa sha ad ba chen sa da pe da ta tu da ni di aden na kha de ne shi ge ho ta ka ko ta ke ha ta le do le na sa ban da kha ba da han ya e dan le ho ma da ba da ya do le na就因的大发现大把很累到发现的，可的那个的你第多就把它养给的你也个为你最好的，就可的把那多提上你的是被大沙子另外是大是种你的包是你一道理，种的都是提把运动不那啥道理，一个也吃都被他的下了。
Yeah, Phyllis.
Chairman.
Committee member. Honorable
Chairman.
Vice Slater. Go ahead.
Chairman Thomas Walker.
Oh, it's Phyllis. Lisa Danila. Oh, see, you sounded different. Of course, yeah, for joining the call. I don't need to tell deals in store. The Human Rights Commission, Dr. Craigie. You have the teleconference for Chile.
Chairman, so committee members, the oversight committee, Shinanta, Atlano, Zenigo, K, and it delegate, they need all this door, honorable delegate from Shiprock, should say. Human Rights Commission commissioners class choices on the ocean and here the Honilson Heki Bekoto Nichana Street or Lico Heki and Nitigo another did making so the Schneko it became Dover Kahanani Catholic now so other that he got his cup the lane could teach between Kito Kondia or the or Besh Bahanet, ya. Is her husband or Tanikle, the issue in Sakis or his Yenat, it's so the Zen Pennish. I could echo Shunda, Steve Darden, that be native Kuyat Shunda, or so the Zen Behin, see here. Whatever the need at answer the Chisla creature. They are another deals in teaching Honanda and how it is Yego, baby, be cut a bed echo. At all hot echo that Kodati need all this. Bahazo Kodo, Nasco, that's what Edo Penny, that's Nani cut all the dark. It's others in that deeds. What echo because nearly definition. The Diego now the Nashni had she, but Lord Oba had the translation of Cadeda, France that deals in what echo Kodoshi, what echo so hot is a Niki large episode. He not it is all this never. Although Shimado Cora Phillips only Sadia Hanatsi Koyat Toshima. What Ella had Mr. Gorman, Leonard Gorman, she had took which is one Lord or Sato Nizadi Sako. I call Dorches on the lead, chairperson and vice chairperson of the Navajo Nation Human Rights Commission, Thomas Walker, in Chef. Ado the Lebanon a country, Bishman San, each not in day by each other. The way I city tour, adding
这里拖到拖呢里，然后里拖，那Hassan 这个给到后里到这个给 Hassan 给到后里或这个是那个，他是那个说的会做到的比较 OK 呀，到这个阿弟的那把那是的被方上也很难解决，或这个到那是你。到有时间是把那些呢，到那也大的很呢，到我是到我个是那哈里亚一辈的，那你把它弄，一直一直弄，然后弄它可以只弄你在那你大个，我打是你去地里啊，一边那我打你去一天生些个，那到那单人家的很呢有时间是会多烂生的，新鲜吃的，那变个托呢，是新，或者呢是吃的，这的是的，但是那了，我到呀还是推是的吃，白的是到开始到呢，我啦到是到的到的，把一起的就kid ada istigi kot ani saho to hot to ligi do eda ani nigi pe hata isti ko ado oversight committee, health education human services committee so budget this she winson hade di kwa has anige sanyas twi nigi hizani ras twi eda di sayin do ta kwa ba honel an kwa tashnit so ikdes ibaz ani ba hollon nigi donanish ba nigi donat an sahatis so ko edna budget this doda ta satinil consider jo sidet di ba shi ego ko even na but kunza ta ol kinde ya akeda huilna chana chairman so quitting class ilna da di ba yati di akistnit ado kistani inilzen ko outdoor nefigi so yo bjna hanta heki na hanta ko ada ashin ba yati di jona lekha jona ni benaide kido so hot ego ado tna sani thui so ni za dati kre is ding tna sani thui do ko kwage so do tik a pandemic gi na ni gi hollo do ego ko hot do ashin yego that's yego that's ba yati do li sa digi today a pandemic na ni ikat hollo ko do ko honne tna bedai tna do jo ba gi dan ne ko ke na kha ajna hoi na ban da ti le nas ni so nas do so de be ada nani ne kha ko ze da ada o ba da istri shi o yen da ji ho agnes ada jo ho dan ne ko ego ni ko ye go na hoi na ba hollo ti de nas ni COVID-19 o ni and ado to ba hazunda ko ti o da jo shi hat ni da sun o shi jin ni da kha pa han de chogo ko ye pen ni do ikut ik da ti ya ik natza it's ado be in ti so da ne ko ado putje na da ba na han da ik ka na conveyed media gi John Gilbert has a Navajo Nation government but in the shiki to the Nebenant media aho news release na ling panel Nebenant this na COVID-19 positive cases do panel tested earlier other fatalities gi panel no ako adot asho ya za na hatni the numbers gi na oh adot biskaha banani te lo te ado to ya ani sha hotza khada to ya khoda da nesh lihad shi na kitne zatin e patahites na ata ajin hallo jo na lo bahan ado the net the nates ado attention le gi do the question akot kwiche e de bahan ne o ada hashi osun ani shi dan si kisto do hashi osun ako di kweba ba hwile ke has twin hizan in gk ni tizna ada zagi chut o to ba hazan da nahallan e atishin to nan abaya ti to shi jinida ako to oyo sto yego itis ada so aban sahakis not ani bada hwile ki na shidan ji which Navajo Nation je ayisa anazin hadani ya hatotsi ablindan ka akot ot to that hadan hadani ro chombo ne tligo ba yada chi ado la shi ada ba san dat ni ban yada hil chi the question yada il kid akot ko lata it on it is count like is count ba nada di no hot ego alen hat abani e benash e shi da do hedand ke benash o ko ti kwa benit ni dana e shina chairman so which was on the sahilo ada je not ya yaki do e shina do edison wanika ko shido da kwanda wanda sa e nashni habana sha ko ayada to what ba when ido le ti honetza I see batin teacher I see adult it is again beda hodozing the nebeda is I adult na do ni saigi edo abaka alikit so hot ba to the hand I up oda his not in the halot the net pen ako it o hashi o senjo de sheko ako at end the teacher ho ba si kunot ashi shinan ado sha stress zane should I ta ba huin and I ta ba na ka I ta big ne ka we ta nil it out the ado ni la cho ha ni recommendations from the executive director Mr. Gorman what ale ba huin what out kha bansas kis queens na ko akoshi da aka ye adole if ba huin she to nan agot ese ko shitzazido bansas kis ko ashi ni ka teacher bishma sa an because ate ko commissioners of Finigi John Washington it asla and he didn't asla and he kay asla ni say in that asla ko e think ba Chinese na yego what andi place sto yego ba Chinese na yego aha ni zin andi place ni na has twi ni man hije ni change nalla je ba ka kid do it what ansen ho ko teacher do ni traje da hot adi o ke ye di e da ba hin ni ta han natle ado ti nasli di jo ni sin tra do ni sin no tra ado ta ni sin si zin ki ko de an ji ga do sa hot ego because between the house now do it now as casually do it just you gave it now nani edo passion that all banan strati teacher besh behind the lo cho at now is no finan ako even na queens and the has aniki ila na hon ado to yen hot end so hot end banit edo le cho do le di ponet sa shit abe ke sazni do le to ka dishwa at kota Johnson ako dit order well yaki off reservation outside the Navajo Nation a hot digi a bego ako ado abanan shida yosin niki the neya da halyan gita hot the ko find it out hajo ya da halnet order ada zu gidanel ado to da zu gidanel ado to da zu bet asleo ako pa ko pa te ko hot hot ko edo sa ope hatis oyanan pa yati John so ban saskis we Joe Winslow the other because I did the campus of care called Queen Nashi Bishwas and translated the reading it the Shana Chairman so that's a target shahaz an Jilly I didn't see question on the committee campus of care ya credo okay there ya I don't find that the need has 20 on it I don't have the need I don't have to get a wheel the jedo day yanda study dental either out of the leader using that not a cottage accord I need what I got or the question then has there's nothing over a son is tweet and such and don't has last out has in such case been there I don't say how that has the what I got I start here national or John ego na is now a cottage question J kid what ela hatila highway ego has ado ashindo honda that ado bohne it should not be jego na hotel what ba haya kota ko asatil as a net ba haya apo and answer issue the not that at all for it begin gala so that's ada ban sas kes ado teacher ko na hot nasli I see na isna out they are to change it on the case ashin hajo by yatio in sakiston in hat his an hat ken do kat the bed eke e ba ti ko eke ti hot la kwat za la ti la ta do ti do kwa do na do ni jo do di ni na the banan ta the lebanese ni shi jo hot e go la e ban sas case ko Jalan asa Swiss zani hun so shi sa de has si do li kwa shaho ki German social na she kwa shahwin ko he do le hot ela sa Swiss zani Jalan chess members في شخص شتو بحثي شتو
Chair Halona.
Halona, Honorable Halona, go ahead.
Oh, that's a chat now.
Thank you for giving me the floor today. I just wanted to say a few things about how it happens when you take care of an elderly person. I myself had done that for, I think my mom was 80 years old when I first moved home to take care of her. And during the time that I was here taking care of my mom and dad, my mom and dad's name is Wilson and Ruby Halona. And I moved home back in 2004, maybe a little bit earlier than that. And my goal was to see my parents were taking care of every need that they had was being met. And that was the main reason why I moved home, was just to take care of my parents. Along the way, I found out there was a lot of people in the same position that I was in with their parents. And then, so I started thinking about how we could service our people. I was visiting my uncles in Albuquerque at the nursing home there, and every time I went to visit him with my mom and dad, he would be sitting there by the door every day, every time. He would sit there all day waiting for somebody to come and take him home. And that was painful to leave him there all the time, because he would be sitting there the next time when we came to visit him. And then I learned that there were a lot of people that were in nursing homes who were in that predicament from the reservation. But it's something that you have to dedicate your life to taking care of your parents at home, and not let them go to a nursing home. And if a person loves their parents, cares about their parents enough, they'll see to it that they don't have any problems in their elderly years, and that they're well taken care of, well fed, and don't have to be worrying about where their next meal is coming from, who's going to prepare it, who's going to keep the house warm, who's going to wash their clothes, who's going to bathe them, who's going to be taking them to the clinic, to the doctors. So I started looking into nursing home. How did we get a nursing home out here in the community, preferably out here in Tohatchee? And that's one of my goals, is to try to get that started somehow. I see that Chinle Nursing Home, and since I've been working with this program, it takes a dedication from somebody who wants to run that service. We could bill it, we could put it together, but it's only going to be as good as the people that we have to run the services. And that might be what all these other nursing homes around the border towns are having to put up with, is that maybe they don't have the right personnel there taking care of them. You have to have compassion, a lot of compassion. You have to be super patient. You just have to be in their shoes, because when you talk to an elderly person and you offer them stuff, offer them some sort of help, they always turn you down. Oh, I'm okay. In the back of your mind, you really know they want something. And then when the elderlies too are afraid to ask anybody for help. I learned that. I tried to get my mom and dad to be sure to let them know whatever they needed, whatever they wanted. If they just wanted a cup of coffee, a drink of water, whatever, I'll be there to help them, to get it for them. But they never asked. But I sat there and watched them, and I knew how long it was before they last had a cup of coffee or a snack or a drink of water or something. And pretty soon you're there long enough with them, you know automatically, oh, it's time for a snack, time for breakfast, it's time for water, they need something to drink, or let's go for a ride. Get out of the house. Instead of just staying in one place all the time. It's no secret that we need more elderly homes right here on the reservation on the Navajo Nation. The two elderly homes, the homes that we have out there in Chinle, and they're not enough. The new one that they built was a start, but we got to keep moving forward in that direction and put one, hopefully, in each agency. At least that'll help. We can start with that. But to get a program together for people and helping people to take care of their elderly parents, that's another way. What do you call that? Assisted living. Elderly care homes. There's a lot of elderlies out there who are living alone also. They need help during the winter time. And then they need a place to stay during the winter time. In the summertime and the warmer months, they can go back to their own homes. Because that's where they really want to be. That's where they're going to feel comfortable. And I've seen that when I was going around working for the agricultural census, counting sheep and horses and cattle, and I would come upon a house where there would be an elderly lady there by herself. Nobody was around. And you can't walk off from them. They ask you for a little bit of assistance, a little help. You just got to, you even though you're busy and you got to go and doing your job, we always stay behind, try to help them out with what they wanted. If they needed wood, or if they needed to chop some wood, or if they needed to bring some water in. So I've seen that. It's a problem. Those kind of elderly people that can actually take care of themselves during the summertime, the warmer months, if they had a place to go during the winter months to help them survive and get by and not have to worry about cold weather and wood and building fire and keeping warm, propane. It's a hard job. I did it for, my mom left me when she was 95. I started taking care of her. She was 80 years old. My dad was 76. My parents both left me at 95. Takes dedication, a lot of hard work to take care of elderly parents at home. So how do you help those people at home? How do you help those people who are taking care of their elderly at home? A lot of those people, some of those people don't qualify for a nursing home. So it's a big problem right here on the reservation, and that we have to work at it little by little, and we, with everything here on the Navajo Nation, the way the politics governs our decisions, sometimes it's hard to get nursing homes started. It's hard to get homes built, even for clinics. Nursing home, you're going to have a staffing. You're going to have housing here, especially here in Tohatchi. It's long-term planning, long-term range, and you have to have the people who are dedicated. So those are my thoughts right now as far as the nursing homes are concerned. I know there's a problem out there off the reservation, in the reservation border towns. But we got to make some changes somehow, and those changes will be slow, but they'll be positive. Right now, to address this situation, that we're faced against right now. With I didn't know, I didn't hear the report about the 40 people that passed over there in Winslow Nursing Home. That was kind of upsetting. And the lady that was talking about a Republican state, yeah, you're right. Change comes in a slow pace. Hopefully Arizona's moving into a Democratic state where people will start to think different. But I do agree that we need to do something different with the nursing homes, and I think we need to start some sort of program where we can start bringing those facilities out to the Navajo Nation, spread them out around the reservation here. I support that simply because I know what it takes. I know what the elderlies need. I know what they're thinking. They're scared. They're afraid of everybody and everything around them. When I go out to the public and I see an elderly person sitting there alone, walk up to them and say hello. Ask them how they're doing. And they really appreciate that. How do you get our Navajo people is thinking in those same lines where you hold our very elderly people upon a pedestal and make sure that their every need is met? Lots of dedication, hard work. Not everybody's into that. Not everybody has that on their mind. They're always trying to take care of their own lives and make something for their own selves. So the elderly fall by the wayside. They're the last ones that get attention. So the big question there is, how do you turn that around? It starts in the family and the home again. How do you train the people, tell the people teach your kids the right way and do the right thing. Take care of your elderly people. Take care of your grandpas and your chays, your grandmothers.
Hello. Please leave a message after the tone.
So it's a big, hard decision, and I see we got to, as leaders, we got to do something about it. We all have to be on the same page if this is what we're going to do. Whether it's through legislation or other means, creating a home center or elderly home center, care center, or even a part-time care center where they can go to wintertime and go back home to their regular homes and spend time with their families and spend time where they feel comfortable. So that's what I've learned about taking care of elderly parents, elderly people, and I see all these other people out there. That's, like I said, I thought I was the only one, but the more and more I was in the community and see all the different people that are in the same predicament. And they don't have the resources to be there with their parents all the time to take care of their elderly grandparents or parents. My dad was a veteran. I took advantage of the United States and got money that he was owed from the United States Veterans Administration. That's what helped me to stay home with my parents. And this is 24/7. 365 days a week, they have to be cared for, especially the older they get. And then there are those who are not, need medical attention every day. sometimes they have to be in a nursing home to be cared for because of the conditions that they're in. So those are just a few of my thoughts right there, Chair. Thank you for listening.
Sheila, Honorable Halona, committee members, we have a Navajo Nation special session at 1, and I'm getting a text message that Cecilia, Leonard Gorman, you have the floor.
Yeah, I just want to have a brief clarification on these recommendations that we're offering to you from the Navajo Nation Human Rights Commission. There's 6 different recommendations. And it would be nice if the meeting votes on pursuing these recommendations immediately. DLA Piper law firm. DLA Piper, it's a really huge law firm. It's an international law firm. Pro bono no. ADG da abonet zanatleko da is jan nihnigo ben kagone is jan shi do bedatini tatati no. Kwaike khese ya gato zin no inan kitel kid benda. An hishinto lehne nikito need Navajo Nation Human Rights Commission Jojo Beto sin in beneath the nan hidden jojo ya benas nasato kash Odakidati Okoko Ada Zitlu How so that Do Kudan Winslow How so Daki Thomas Walker Isaac and Hadai Neatle Hanalan Nani Esa out Abadao Dito Katen Dagon Zondo Lich A Quake Joe Quake had is a ya Inike do Lich Dona no Tobe Belcha Dicey. Bazan ko ya o ziiki beka de nota beka ni te on zondo le aro de net alla yidini zozo inasati yado le isja yota belcha da si class action is nico ya all dande yidini zozo in zondo le o kdiki ya halet ya national nasikalto le lauda I did in legal da ya contingency basis nicht in lete that is chance do hard on nicht ni peso da ya na lieta as lita trechit hago da ka ko benas be panet into le as like nota ya be hit out all z ero died I that or hit hago da Abes anik I get out no to I go the shifto peso da joy KD da ba dento lechi do lech no o kwagit ya job harder dit da kidi ni do benda ya be tracy krenje kodo o ko kwagis naha ya support of indo lechon kidi nenigi. I just wanted to clarify it a little bit more. Okay, so I don't that the resolution niki that's kinda how ako yahut ego Human Rights Commission niki budget they so I done do the naiba basale the other job bit the aden dark kind no they say they ni or you live I don't know bears anik I think if they needs to like Division of Health or Division of Social Services. Our chair gives to Igai in the Hako ADG to A wado a binan kindo lektiko an ikeba da hiliat wado destiko. Aron the data wagi hidaya a peso gindan teko da could it wagi da out of being called ikeba da hiliado late. Arokodo banda sidas twido sani bada yadan he ike bakagi hut edo late. Ninigi tota ken tego ekodo. Yan hit she to dequa a hilinikin hit with a silly do lish. Nida she stop John do lish. Because those not do be lasney or a what I am in a Nisiki case in the loeb could have best crazy cadolish. Yeah.
Hagushila. General Kate Nina, Honorable Vice Chair. You have the teleconference floor. Cecilia.
Chair, can you hear me?
Oh,
Okay, thank you. Can we pull back up the points that were just listed? I don't know if there's a way for Mr. Gorman to be able to screen share again, whoever was doing that. Okay, so 3A, support the effort to engage in formal legal efforts against the care facilities. I didn't quite catch all that in that. Can you reiterate, is there an ongoing legal initiative right now, or is the idea that we could pursue it with DLA?
Okay. All right. As I've explained in Navajo early on, we already have 2 written complaints in our office. One we've already been working on with the party out of Utah. This is a facility in San Juan County, Utah. We administered a questionnaire already. We hope that we will get more Navajo citizens that have relatives and that are in that facility to participate in that questionnaire. When we try to move forward with some effort, we administer a questionnaire to get an idea from the individuals what's going on here. So we did that. We want to collect more information from more people that have relatives there. Now, the second one is the Arizona Center. We'll have an intake meeting with them next week. We'll go through the same process again. And the information that we're getting is that we're 55 referrals made and 40 have passed. That's a very, very high number that passed. Something's going on here. So what we've been doing thus far with the current complaint that we're working with out of Utah is that we realize that there's been so many communications that have occurred last year on that particular matter in Utah. Communications between the citizens and some private lawyers with the Navajo government. There's not been any response from the Navajo government that we have surfaced thus far. Maybe we're not searching good enough, but we've even got the additional recommendations and comments as late as earlier this week. We have a timeline to satisfy, and that timeline is coming very fast. We have to do something about this by the mid part of July this year. Okay.
Mr. Chair? Mr. Chair?
yes. Mr. Halen.
Yeah. I listened to, I'm sorry, for the listeners, Ron Haven, Legislative Counsel's Office. I've been listening to the reports here, and I did listen to Mr. Gorman's report there. And I would suggest, if time permits, perhaps Mr. Gorman could assist insofar as explaining these matters in detail. That it seems that that's where we're headed with this. It would be preferable to go into executive session on some of this stuff. I did understand much of the Navajo presentation, and also I think it's something advisable. And our office is available if there's anything that we need to do insofar as HESI and also directions to be provided to Mr. Gorman's office supporting that type of things insofar as resolutions. But insofar as the details of this, perhaps it would be advisable to go into executive session. Again, I do understand you do have a session coming up in 20 minutes or so. With that, thank you, Mr. Chair. I do, before I end here, finish here, I mean, with this small statement, there the Division of Health has provided, I think, some of the committee members, I'm hoping all have provided copies of the email sent by Valerie Jones. I think the email is dated for February 22nd. It explains some of the ombudsman position insofar as are the responsibilities of the Navajo Nation under the contract with Arizona DES. So if some of that stuff you haven't got, I will be glad to forward that to you because I got a copy of that. So if there's any questions on that, certainly I can try to answer some of that. But nonetheless, I'm going to go ahead and end there. Thank you, Mr. Chair.
Kusila, thank you, Mr. Haven, Vice Chair Slater. Perhaps you make the motion, and then that'll free up some of the discussion and the recap of some of the actions that will be necessary. But I really feel like it's necessary. Ashwat Etzetele, Mr. Gorman. Madam Chair. The net deal. Oh,
Chair.
Go ahead, sir.
Thanks. Okay, I don't want to go into executive session now. I mean, we got 19 minutes until Navajo Nation Council session starts. When council is in session, you can't have any other meetings. So, if they had quorum and started the meeting, we could just be out of order kind of right off the bat. So, and that's it. I think we need to have a much more focused discussion on the legal aspect. But I just want to make a couple comments, and that is, we've received reports now at the committee from the Division of Social Services, and one of the numbers that that stuck out to me is that I think 82 or 85% of of the individuals who are in the case management system with DSS, they are receiving in-home care. So the overwhelming majority of our people are being taken care of in their homes. And so when we talk about, we need to build things on the reservation or we need to return to in-home care, that is what's happening. Now, does it mean that it's relatives who are taking care of them and being compensated for it? No, not necessarily. And that data wasn't provided either. I'm not sure if they would have something like that. Maybe that's a survey or a questionnaire we can pursue. But, there is some data. We should use that to inform how we move forward. And I don't want us to characterize or mischaracterize this from the outset, because all of those assumptions are going to lead to probably bad policy making in the end. But I think moving forward, those recommendations are really good. I want to hear from Office of Legislative Counsel, from Human Rights Commission's counsel, from DOJ, before we pass any sort of resolution or do anything that would assign this topic exclusively to the Human Rights Commission and then authorize them to pursue these legal actions. And I don't know. I just want to see kind of what the delineation is of responsibilities and all of that. Because what's concerning to me is that at the beginning of this presentation, I can't remember which commissioner, if it was multiple commissioners, are saying, we're pushing the commission staff, constantly. And if there's only so much bandwidth that the staff has right now, then, I don't want this to go to the wayside. Maybe we need to break up some of these responsibilities and share them among different entities of the Navajo Nation. I think that it'd be very appropriate for, the Office of the Auditor General to look into the program performance under DOH and DSS. Just anecdotally at our committee and also the Budget and Finance Committee, we've seen some real deficiencies in the grants management from the programs and how they're actually pushing funding out the door and overseeing it when they have it. And that's not necessarily a responsibility of the Human Rights Commission, something that they can document, but when it comes to either imposing some sort of sanction or trying to create a corrective action, that responsibility rests with the council and with, HES. So, I think we need to, I don't know if people will be open to an in-person meeting once people are a little more vaccinated. I think us on HES, we need to start exploring that option more. And it's going to lead to, I think, more accountability in what we're able to get done. But I think, it's really just because all of us, we come from families, we have grandparents, we have elders in our family. It's easy to get caught in these anecdotes, but what's important is to focus on the data that we have available to us, the laws that govern these facilities, and, kind of differentiate what can be near-term steps for improved care and accountability, and then what are longer term steps for a system-wide change. And to me, that's looking at, well, we have to go through access because we don't have a Navajo Nation state Medicaid agency. So right off the bat, the best way to assert control over Medicaid recipients, really, in that whole process, is to have a state Medicaid agency. Now, we know it's jointly administered right between the states, and the states have to pitch in some funding too. Would the Navajo Nation be capable of doing that? Is that something we really can do, to make this happen? Or would we be looking toward the states counting those citizens, paying the Navajo Nation essentially? And then if they're going to pay the nation, then you'd have to have some sort of agreement on what sort of oversight responsibilities the state might have. But, I think we do need to set some near-term goals, some medium-term and long-term goals. And in general, the committee has been, I think, supportive of that idea, moving toward having a Navajo Nation Medicaid agency. But when it comes to overseeing all of these facilities and then the quality of care within, people's homes, we have a long way to go. And I think the best way to fund those positions so that it's sustainable, is to capture some of that revenue that the states have. They are able to, or they're supposed to use to follow up and oversee these facilities. But a part of it could be simplifying oversight too. There's a patchwork that we've seen. The references by our programs were, well, they notified the county health commission. They did the county health offices. These facilities did everything, and they're in compliance. And so it's recognizing what the shortcomings are of being in compliance. And I think that just means that the Navajo Nation has to assert itself to a greater extent in overseeing these facilities. And ombudsman's good, right? But that's not someone who exercises control over a facility or has the ability to withhold money. And ultimately, he who has the purse is going to control things. And unless there's a plan to move toward the nation having the purse, it's going to be more and more difficult, or it'll always be difficult for us to actually, I think, assert sort of system-wide control over our citizens who are in different facilities. The last thing I'm going to say is, we have 3 different states, maybe 4 states. I'm sure we have, actually in that report, there was nobody in Colorado from what I could see. Maybe that would change in the future. I don't know. But this is not just an Arizona issue, even though we have Arizona folks who referred into New Mexico. I really appreciate Director Gorman bringing up, these Utah issues that they're confronting right now. We should have a position that's independent of any state. Now, we need to recognize the difference of, with each state, but we're just going to be reactive if we're just talking about, oh, well, this is the circumstances here and this is the circumstances here. You know, and we're being reactive right now because of Winslow Campus of Care, and I think that's what Mr. Adekai was talking about. So let's establish this vision going forward of where we want to be, and that I think is great when you have politically elected leadership who can exert vision, and then you have commissioners who can exert vision. We're not held back by, say, the same limitations of people who are in the executive branch or who are employees, yada, yada, yada. So that's what I ask, and I think we really do need to have another follow-up work session and executive session on this item and a few other ones, and we should communicate on bringing in DOJ, OLC, and then human rights. I apologize, the Human Rights Commission's lawyers.
This is Jennifer Danette Dale. I do want to say that we have an opportunity here with the Human Rights Commission to move forward on an immediately a pressing issue that were raised with the nursing facilities, that this needs immediate action. We are offering to network and support families who are pursuing this. And I think on that issue alone, we are asking for a support. So I don't know if you want to separate those issues in terms of the long term, in terms of the evaluating and doing our research on this issue, but there is the immediate issues, and we are responding to allegations of racism in the care facilities. And so I think on that point, we are asking for the committee's support to pursue that specific issue.
Thank you, Ciara, other members of the HES. What I see when Division of Social Services basically giving us percentages. Oh, we only have 3% of our elderly population in nursing home. That's trivializing the 40 folks that passed away. And for me, that doesn't buy what they're trying to prove. And in that regard, yes, these other coordinated meetings can, happen. But right now, we have information that's provided by the commission and the director. In that aspect, committee members, I'm asking for a motion and a second to accept the report and to basically give support to the commission.
Chair, Wanika.
And then we go forward with legislation. Based on the bullet point items that Mr. Gorman highlighted to us. Honorable Edison Wanika.
Yeah, Chair, I agree. I am concerned about what Jennifer and also Mr. Gorman is saying, because there is a timeline. And then there's a possibility that they'll be getting help from the DL Piper as far as the firm. And I think it's a very good opportunity for them to start pursuing that. So I'd like to go ahead and make that motion to go ahead and support what they're doing.
Yes, in accepting the report. Thank you. Cecilia, Honorable Wanika, do I hear a second?
Second, Halona.
Washila, it's on us. Arushi, I thought a commissioner, so I thought you had your vote on going forward with what this committee is doing. Maybe you could just say what your vote was on your action. But to do this, and we're running short on time, I want to put this motion to a roll call vote to put it on record, because we got just a few minutes before we can't be meeting. Mr. Mose.
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Charlene So.
Green.
Honorable Charlene So votes green. Honorable Edson J. Wanika. Green. Honorable Edson J. Wanika votes green. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Chair, a vote of 5 in favor, 0 opposed.
Thank you, committee members. Otto, Madam Chair. That's it. At this time, we're just going to have to adjourn without going to the other aspects of what was on our agenda. The law basically says that when the council is in session, no other committee is allowed to meet. So we got away with part of it from 10 to 1, probably 12:59. So 8
Delegate, so could we quickly also have a call from the commissioners too, for their vote? Commissioners, may I hear your vote on the motion?
Aye. Darden?
Commissioner Phillips, aye.
Commissioner Adekai?
He needs to unmute.
I'm thinking about it. I don't know. I have mixed feelings about this because investigation, in-depth investigation has to be done, inquiries, get to the bottom of what happened and so forth. So, but for the resolution, I do vote in favor of it.
Okay, and I also vote yes. So we have commissioners, all 4 vote yes in support of